Good morning.
Good morning. Everybody fix their hair. So what'd you all do this weekend?
Worked.
Worked?
I had to work too.
Oh, yeah? But it was a weekend, right? You still had a weekend. More or less. Nobody went to the lake or went to Florida or... No.
I don't think anyone's awake.
I don't think so either. What kind of dog you got, Becca? Looks like an husky.
Yes, I have a husky and then a fox kind of dog.
Oh, I see. Oh, yeah, I see. I see.
Well, I'm glad we have the mute button because they are really loud.
Well, I may have to use the mute button too because Reagan, I don't know if you can see Reagan. Let's see if we can do that. She's over by the window.
She's so cute. Her little couch.
Yeah, she has a little couch. She loves that chair and it's so beat up, it's awful looking. But it's her place. She likes it. I'm stuck. My chair's stuck. All right, so it's almost time to get started. I don't know if you noticed or not, but I fixed the link. It wasn't till this morning with the article. The Zypress and Ream article is the Walker and Avant concept analysis. And anyway, I couldn't, the link was not working right from home. So anyway, I just put the file up, which is I'm not really supposed to do. I'm supposed to just give you a link to the library. Bless you. So anyway, so you have the files. You can at least see how they did it for a concept analysis. Okay, so we've got a couple more minutes. So I'm gonna just turn off my video for a second. No, I'll just leave it on. You'll just have to put up with me, I guess. What else do you have this week? Did you have class after this morning?
We have stats after this.
And is it it's not asynchronous, right? It's synchronous?
It's synchronous, but you can choose if you want to come to the classes or not, depending on what your weaknesses are.
Okay.
But attendance based on like the quizzes that he has.
Okay.
You have a dog too.
Yeah, she's so spoiled. She like cuddles with me in bed. Her name's Fricklin. She's a German Shepherd. Say hi.
She's with her people. So if we start to lag this morning like we did last week, I'm just going to ask everybody to turn off cameras, but for the time being, let's keep them on. And we'll just see how that works. Sometimes mid-morning it'll get a little more laggy, so we'll just kind of see. So it's 8. I'm going to go ahead and start. The way we're going to do class this morning is we're going to talk a little bit about concepts and how they're derived and so forth first, and then we've got an in-class activity we're going to do. So I have divided you up in groups, and I'm going to put you in rooms in Zoom so that you can work on it together. And we'll have you'll have like 30 minutes or so to work on it, and then you'll come back into class. I'll bring you back into the main room. So we'll do that in the second hour, but to begin with, we'll start with just content. But so I'm wondering what you remember from last week. Think about what you remember from last week.
There are a lot of theories that we use in nursing that we don't even realize sometimes.
Okay.
Germ theory.
The germ theory. Anybody look up the germ theory? Okay, just as I'm going to ask you to do a poll. We'll put a poll up and you can vote. The question is, and this will be anonymous. Oh, shoot. Okay. Hold on just one second. Okay. Hang tight. Perfect. All right. So now then, I have a question for you. I have to get back to my meeting. Okay. All right, so I'm going to launch the poll. There's one question on it. You just have to answer it yes or no. It is anonymous. Okay, good deal. I'm impressed. Oh no, we're going up. Never mind. I'm going to wait. So we have 20 people voting, 21 people voting so far. Has everybody voted? There's 22. I think there's 25 of us. Yes. Okay, so most of you use the study guide. Hopefully that was helpful for you as you were reading. So you talked about multiple theories that we use in practice and sometimes don't know about it. So do you recall the concepts, the major concepts of the profession that originated back in the 70s? There were 4 major concepts.
Is it the person, health, nursing, environment, scope, or no? Is that not it?
Person, health, environment, and nursing.
Oh, okay.
Yeah, person, health, and environment, and nursing. So that was developed back in the 60s, the 60s and 70s, I should say. And so we're going to talk more about concepts today, but it was important for you to think about last week what the major items were, because what are major items in our discipline are very different from what major concepts are in other disciplines. Now, we do know that there's one concept that you don't see in there, but that we talk about all the time, and that's caring. But caring typically is shared by a lot of disciplines, so we don't have a market on that one, despite what people might think. So let's take a look then and just think about what these concepts actually do. I mean, why we even have concepts. So I'm going to just have a few things on a PowerPoint we're going to look at, and then we're going to, let me get this shared. Okay, so just from this standpoint, we know that there was some discussion early on about how should nursing be defined, and that's how concepts began to start developing. You know, what is it that nurses are interested in? What is it that is in that language that's used generally is what is of concern to nursing? And so that's how a lot of those concepts began. And so you talked about those first four. Remember, person, health, nursing, and environment. Typically, all of our nursing theorists will include all of those in it. When we get to other theories, things like the germ theory, that's considered a shared theory because we use it, but so do microbiologists and so do physicians, and so that lots of disciplines use it. But that will likely include, as most shared theories do, maybe one of these four, maybe not all. And so we share it because we have something in common with another discipline, but it doesn't encompass our entire discipline. So did anybody look up the germ theory? Anybody have any concepts that are part of the germ theory?
Pathogens,
Pathogens, good. What else?
hand washing.
Well, yeah, but from the original, from the original germ theory, yes, pathogens in particular, infection would be another one, right? Hand washing was sort of a consequence that came out of that. You know, if these things are made up of the germ theory, then and so there would be other concepts like transmission. You know, how pathogens create infection. You know, so there's other pieces of that. So we'll talk about that a little more as we move along, and you'll see how those concepts have been put together to create an explanation for how infection happens. And then, of course, we've built on it over the years. So remember last week we talked about the concepts that were central to nursing, and those were kind of solidified in the 70s. But then we've looked at other domains in nursing. So these have all had, and this is specifically from Melise. So she's known for a theory in transition, but she also incorporated all of these things and defined them as domains within the nursing profession. Now that doesn't mean they're the only ones. It means that's what her work evolved into. All right, so from 1986 to 1990, and I'm going back to doing some history, there were epistemological dates. Now, can somebody define epistemology for me? Or epistemological dates? What does that mean exactly? That is a philosophical term. So if you go back to your philosophy, that's where you'll find epistemology.
I guess epistemology is like a theory, I guess, of like knowledge. It kind of helps you to distinguish between what somebody believes in and what's just like an opinion, like without facts, I guess.
Yeah, exactly. And so epistemology is what you consider as true. And so from a nursing standpoint, or from any standpoint, exactly, epistemological debates would be, what do you consider to be absolute? What do you consider to be truth? What do you consider to be valid and reliable? Maybe not reliable, but valid. And so, for example, I'm a qualitative researcher. So from an epistemological standpoint, I believe that people people's perception help make up their own reality. But those who are much more quantitatively based, their epistemology would consider more what is real and what is factual, or what is truth rather, to be facts, things that you can measure, that sort of thing. So we all have our own perspective on epistemology, what we believe to be true. And so disciplines tend to study it, and philosophers tend to study it even more. So the ontological analysis is also a philosophical term. It means what it means to be. And so over those 4 years, remember earlier than that, we were trying to define nursing, what nursing really is and how you would define it. But then we got the 4 main concepts. Those domains didn't come till much later. But gradually we began to develop concepts within nursing, and how we go about analyzing concepts. So the concept development part began to be a link between what nurses do and what we know, which doesn't sound like it should be different, right? But what you do is very often difficult to describe. I'll give you an example. For those of you who have worked 12-hour shifts, and I would say most of you have you ever tried to describe to somebody what you did in those 12 hours? What happens when you try to describe what happens in your 12-hour day?
You summarize what you have done throughout the day. You won't be able to go through each of the things otherwise.
Okay.
It changes.
What?
It changes.
It changes, right? It changes. Anybody else?
Or sometimes it feels like you didn't do as much as you did. You're just telling you did.
Yeah, there's not words for it, is there?
Mm-hmm.
Are there?
No, like that's how I feel.
Yeah. And so somebody will say, well, what did you do all day? And you haven't had a break, you haven't been to the bathroom, you're exhausted. And yet when you try to put it in language, there's just not very much there. And so we began to look at ways in which we could describe our discipline. So if you have, are you all familiar with Patricia Benner? Anybody familiar with that author?
Yes.
If you're not, you will be eventually, but Benner was one who began to do, she was really did a seminal work, that is an original work that has sort of stood the test of time. Seminal is a word that you need to know, but it's a classic word that has stood the test of time. She interviewed hundreds of nurses, and so she wrote a book and developed a theory called novice to expert. And so you've probably heard that language in hospitals. Some hospitals nursing departments have picked that up as a way to describe ladders, for example. We often describe students who begin nursing as novices. When they graduate, we think of them as advanced beginners because they have some knowledge but not a whole lot yet. So there's a lot of those, that piece of language in that theory. But she was trying to describe what nursing practice actually is and how it's explained by, how it's described by a novice nurse versus how the same situation might be described by an expert nurse. And so she would ask, how did you know this? How did you know that? And so I won't go into a lot of hers, but that was part of that concept developed, because we didn't really use the word novice in nursing until she began to use that in her research. And so when we think about how we get concepts in nursing, sometimes they evolve over time, or they come from other theories and they're applied to nursing. And that's the case she had. She used a theory that came from another discipline and another author, and she took those concepts and applied them to nursing. And so then all of a sudden we start talking about novices and experts and competence and that sort of thing. A lot of that knowledge, a lot of that language rather, came from Benner back in the 80s. And so that's how we get some of our concepts. So let's think about what a concept actually is. Can anybody tell me what it is? Well, what would be some other words for concept?
I think of like,
Maybe like a thought or an idea.
Okay, good, good.
Definition of something?
The what?
Definition of something?
Definition, yes, could be a definition. We're going to talk about those too. Anybody else?
It's a mental image.
Yeah, a mental image. What?
Phenomena.
Yes.
Phenomena.
Yes. Uh-huh. Mm-hmm.
Way to put a phenomenon into words so that we can speak about it and mutually know what it is between each other.
Exactly. So if we didn't name concepts, we wouldn't be able to talk about them. And so we might think about them, but when we begin to label them, then Demir and I can talk about the same thing because we know we understand what we're talking about. Otherwise, it's like that day you have when you can describe it to a nurse, but you might not be able to describe it to your loved ones, your family at home, because they don't share the same language you do. So concepts really help to make up our language. They give us, the mental model is that picture that you have in your head. So if I say, oh, my 12-hour shift, we had a patient that was, let's say, trying to get out of bed all night or was hallucinating. Well, I know what an hallucination looks like, and you know what a hallucination looks like. Other people may or may not. If I talk about a code, then you have an immediate mental model of what that looks like, what it feels like. You've been in them before. The adrenaline, how many people are involved. You have a really solid mental model of that. Most people don't. And so we know that because when people say, oh, I want everything done for my family member, we know that when they say everything, our everything is probably different from their everything, right? And so the mental model that you have is what we consider as concept. So we put labels on things. Demir is talking about, you give a word to that mental image so that you can at least converse about it, write about, research about it. So are things that we agree on. So these are all different pieces or ways to think about what a concept is. So not to be confusing, concept is an idea, it's a mental model, it's something you think about, you give a label to. It's a category of something. Some concepts have dimensions to them. So I'm going to talk about that in just a minute. They have attributes, that is, they have characteristics. And properties to them. So when you begin to do concept analysis, you're going to look at all those pieces of it and what actually makes up a particular concept and how people have talked about it. So if you look at these pictures, for example, all of those would give you a mental model, right? So one of them obviously is a stethoscope. One of them is indicates a baseball game, maybe. Could be a number of things. We know what this sign is, right? We know that picture conveys a lot more than a word would convey. So it's a mental model of a concept of please be quiet. We know what a heart is, we know what a cross is. In this case, this is a dog, or in my case, it'd be a golden doodle. So we can, once we put labels on them, then we can have some language about it. And so once these are formulated, then it guides what we see. And so it gives us some order to our observations that we can talk about. So when you're talking about advanced practice, why it's important to understand concepts is that it is a clarifying piece to your communication. And so you know that you have to be very clear in teaching patients, but you also have to be clear about what it is you're reading and what kinds of things you're changing in your practice. And so these concepts and how they're defined is critical. So here's just an example. Before we had a concept named burnout, we didn't see it. You know, we would say, oh, she's having, or he's having a breakdown. But once we begin to identify, call it a name, called burnout, then it began to have some dimensions to it and some properties, some attributes. You ever seen anybody who is burned out? Anybody? What would it look like? What's a characteristic of burnout?
Being tired.
Unable to make clear decisions.
Okay. Okay.
Being overwhelmed.
Be what?
Overwhelmed.
Overwhelmed? Mm-hmm.
Frustration.
Frustration. Uh-huh.
Not really caring about your quality of work.
Okay, not caring about your quality of work.
Lack of compassion towards patient.
Yep.
Lack of motivation.
Yep, lack of motivation. Sometimes people come into work and they're just grumpy to start the day. They don't want to be there. They don't want to participate. They don't want to, and everybody knows, right? Everybody knows she's really burned out. She needs X. He needs to take some time off. Sometimes when people are burned out, that's the last thing they want to do is take time off because they don't realize they need it. But we've had a lot of research done on burnout. So now that we understand, now that we identify it, then what they began to do with the research is begin to attribute characteristics to it so that we could talk about it clearly, and then we could actually begin to treat it because we knew what we were looking for. Then we could develop instruments to assess it. We could develop therapies to treat it. So, and tools to evaluate whether it's there or not there. We could evaluate whether it's improved or not. So, giving language is something we have to do as human beings. I mean, that's what we have, is the cognitive ability to converse in very specific, complex ways. But concepts are the ones, that's what gives us the ability to do it. So let's think about where they come from, okay? We can develop them from scratch. We can make up words for them. I have no idea what the origin of burnout is. I don't know if it was a term that somebody else had that we borrowed. Does anybody know that? Okay, I'm not sure I know it either. I'd have to go look it up. But I do know that there are a few concepts that have been derived from other disciplines. So let me ask you a question. If I said, let's say a dating couple, or let's think about, let's go back to high school or middle school, and there's a dating couple, and the scoop around the school is, well, they got to what? Second base. first base. Anybody know what that means? I see a lot of smiles, so I know that you know what that means. So that's a derived concept. You knew exactly what I was talking about. And I used it in a very different context from a baseball game, right? So a derived concept is something that comes from, it's a metaphor, it comes from another discipline. We reassign a definition to it, and often we use it as a, as a metaphor. We may use it as a, just a way not to talk about things. I'll give you another example. There's a phrase called kicking the bucket. Anybody know what that means?
Yes.
What's that mean?
Passing away.
Yeah. Passing away is another way to talk about it. It means somebody died, right? It means somebody died. Okay, so kicking the bucket actually originated in the West when they hung people. And so, well, I shouldn't say just in the West, but it originated when they hung people. So they put people standing on a bucket and then a loop around their neck, and then they kick the bucket out from under them. So we use it a little more loosely than that. We don't use it quite as literally as they did then, but we borrow those kinds of concepts when they're appropriate. So we can, you think about something that happens and you don't want, and you want to use another word for it, but you change what its conceptual meaning is. So it's not a concrete meaning anymore. It's simply a metaphor. So we have a lot of those. So help me name some concepts that are pretty common in nursing. So, for example, let me back up. Let's say there's a concept, and this is a serious one, but I know we have some that are relatively dark humor. So let's say hand washing. That's a concept. It describes an activity, right? So you have a mental image of what hand washing is, right? Typically it's soap and water. Not always though. Sometimes we use sanitizers. But that's even derived because that's fairly new. We didn't always have sanitizers. So washing your hands is a, we would call it a construct, but it's a concept that you think about what you would do in the hospital, right? So think about another concept in a hospital. Another one that we've derived. How do you talk about patients sometimes that you might not say to their face? Yeah, I saw smiles on that one too. We had frequent flyers in the emergency room. What else?
Status dramaticus.
What?
Status dramaticus.
Status dramaticus. That's a good one. I hadn't heard that, but I know exactly what you mean. What else?
We used to call like the uptight, like needy people, Buckhead Betties.
Good one. Good one. Anybody else? Okay, you'll come up with them, but the point is we give a label to them and then everybody shares that. Everybody understands what that means. Okay, we used to have something called a code pink. Anybody ever had a code pink? What was it, Elaine?
Cold pink, that the normal ones just to abduct a baby. That's all I know.
Oh, okay, okay.
But yeah, that's something different, like mini. I don't know.
Okay, when we used the code pink, it was because some physician was giving a nurse a hard time, and we would call a code pink, and we would all surround them and just fold our arms like, we're not going there. We're not doing this. Back away. And so that was our code pink, but you've probably also had a code brown. Anybody had a code brown? Uh-huh. Yeah, I thought so. Yeah.
We have a code brown.
Nobody likes to have a code brown, but everybody needs help with a code brown, so we all have to go. All right, so you get my drift, right? Those are all mental pictures. You know what they mean. They don't necessarily mean anything to patients, or they might have a different mental model, but you can communicate easily within the discipline. Okay, so soccer moms is another one. That's kind of a new one. That's, you know, it's not real old, but that's another type of concept that has been derived from just from basic practices. It's sort of like the Buckhead Betty that we can, you know, that we can describe. So the whole question is, where do concepts come from? Well, we can either assign a new name to it, or we can borrow them from another discipline. So typically they come that way, or they may come from research. But let's get back to the more serious piece of why we have concepts, and the reason we're talking about it is because they're considered the building blocks of theory. So you can't have a theory unless you have a bunch of concepts. And it's the concepts that are then connected to one another that begin to convey how one concept is related to another. And in a theory, concepts have to be related to one another for the theory to be able to explain reality, which is the whole point of a theory, is to explain how things work. Okay, so concepts can have continuums, and they have various sources, but the continuums, can you give me an example of a continuum which starts with abstraction? What would be on the other end? Or if you say abstract versus
concrete.
Yep, concrete. And so very often your concepts have may have a dimension to them, so that in some ways they can be very abstract. Other ways, other concepts can be very concrete. So an abstract concept, can you give me an example, anybody?
Temperature.
Yeah, it could be. It could be. It can also be, yes, I would say it's fairly abstract. It could be measured in some ways. So we're going to talk about that in a few minutes too, because there's such a thing as a conceptual definition and a theoretical definition. So, but if you think of something real abstract, it might be something like hope, or spirituality, or depression, right? So you kind of know it when you see it, but it's sort of a word cloud. You know, it's not real concrete. Another one that might be very concrete might be a chair or a monitor screen. You know, so those can be very concrete. Variability could be one end of the continuum. The other end might be what? Maybe non-variability.
Static.
Yep, there you go. So think of a concept that you might read about in a research article that is a non-variable concept. It either is or it isn't. Can you think of a concept, an idea that either is or isn't? A label, a term. Hint, we use it in demographics.
Gender.
Yep, gender. So that one is what we would consider, traditionally we consider it non-variable. What other kinds of things might be non-variable that you would use, bless you, Becca, that you would use in research?
Race.
I'm sorry?
Race.
Yes, race. What else?
Age.
Age. Exactly. So there's a number of things that we can consider non-variable and some that are varied. And so we often study concepts that vary, right? And that's how they get the name variables in research, because they can vary. Otherwise, we have theoretical, conceptual. So we have these continuums of them that not every concept has that kind of continuum to them, but we're going to look at how you define them. So we know that they come from naturalistic kinds of things. That would be like blood pressure and patient temperature and pulse. Those kinds of things come from the natural world. Some of them come from research, and others are borrowed. So they just have lots of properties to them that you have to look at. But for a discipline to really advance, there's got to be a lot of conceptual development and a lot of conceptual analysis, and then some testing of those concepts for them to be effectively used. And for them to be used in research, then the rest of us can learn the outcomes of them and that sort of thing. But we first have to be able to name things. So for those of you who have already had research, if you recall, when you're in quantitative, if you're reading quantitative, there are always variables in quantitative research, and those variables have to be able to be measured, right, for quantitative research. So for example, you might be studying depression, but there is a depression scale that helps to measure it. Sometimes when we don't know very much about a topic, then what happens is qualitative research will precede anything else, because it is beginning to uncover or discover and either adding labels to findings. Once those findings are labeled, then we can study them even further. So sometimes qualitative research will give origin to some of the concepts and the labels. Okay, so here's an example. Could somebody please tell me what it means to be passive-aggressive? Alex, how about you? Can you tell me what it means to be passive-aggressive? Oh, and how's the sound working today? I forgot to check in with you.
I think that it's working fine. Can you hear me?
Outstanding. Yeah.
So I would describe being passive-aggressive as being aggressive, but attempting to veil it with the appearance of being nice.
Okay. Okay, good. All right. And so, so the appearance of being nice, but sort of between the lines, right? Being pretty aggressive. Maybe the language that they use, that sort of thing. Even body language could describe it. So that we would consider either a theoretical definition or a conceptual definition. In other words, you can say it, you can explain it in various words. We all sort of have a good mental image of what that means. But we can't use, we need those kinds of definitions for us to be able to converse with each other. In order to study a concept, though, we would have to have a operational definition. So you've heard that term before, right? So if you think about a concept might have all of these attributes to them, traits, but not all of them are measurable. And so to have an operational definition for a research project or a theory, for example, you have to be able to describe it in ways that can be measured. So conceptual definition, we can study, but we study it with certain kinds of research designs. But an operational definition means we put some language to it that gives us a measurement. So for example, and I'm going to use something really simple, you know, we can say conceptually a chair is something you sit in, right? But if we were going to operationalize it, we would have to say, well, for purposes of this conversation, a chair has 3 legs, not 4. It's 18 inches off the ground, not 24. It doesn't have arms. Do you see what I'm saying? So operational makes it, you know, very specific about what kind of chair and what it looks like, instead of just what it's used for. So if you think about, for example, if you look at this concept called a customer, we have concepts called patients. So we'd have to look at the attributes, and that's what you're going to be looking at too in a concept analysis, is you're going to have to look at the attributes of a concept. What are the pieces of a concept? What are the parts that have to be there in order for the concept to exist? So in this case, which is a business, obviously a business context, it requires these things to be considered a customer. And so obviously it comes from a logbook or their files, whatever. But that's what they mean when they say, once you're a customer, you have all these things that define you. So theoretical definition is, like you said, Alex, it is the sort of that thin veiling of trying to appear nice when you're really not. You're taking digs at people and things like that. But to be able to be very clear about it, then we have to use an operational definition, which might change from time to time. It might not be always the same operational definition. So when a theorist uses a concept, the theorist defines a concept in the way he or she is using it in that particular theory. And it may not be used in the same way in every other theory. So the definition can be context-based, basically. So, for example, if we were going to measure, if we had an operational definition of passive aggression, we would want to measure the level of aggression in order, you know, to be able to use a tool. So it's important for you to know theoretical definition, which is sometimes called a conceptual definition, by the way. A conceptual definition or an operational definition. Those 2 items are really important for you to understand when you start looking at theories. Because without an operational definition, the theory really can't be tested very well, depending on the kind of research that they're using. So the whole purpose of a theory, right, is to explain reality as people see it, to explain what's going on. That's where the germ theory comes from. We have a lot of other theories. That's how we know about infection. That's how we know about transmission of microbes. They all have theories to explain the reality and put it into words. But to be able to use it in research, then it's got to have some way for it to be measured. So, somebody please summarize for me what a concept is and why it's important for us to know it. Okay, go ahead.
So I think of it, you said a concept is like an idea or a thought, and it's a way that we can converse with other people that might not be in the same profession, but it's a way to get an idea across to other people.
Okay, okay. All right, now somebody tell me why we need those for beyond that in nursing.
If we're able to talk to each other and understand each other, that's the basis for building your knowledge base in research and everything, and being able to organize what you're doing at work, what you're doing for the patients. It's everything, really, in a sense.
Okay, good. So the more language we have, the better we understand concepts and their meaning, the better off we're going to be with conversing with within our discipline, outside our discipline. But we also have to understand that those concepts may have different meanings in different contexts. But from a theory standpoint, a theory is made up of concepts. You can't have a theory without concepts, period. Okay, so our next, we're going to move into concept analysis in just a few minutes, but just remember when we start to do the concept analysis, it's an iterative process. In other words, it has steps to it, as Walker and Avant talked about. There are steps to it, but sometimes when you get to a certain point, you have to go back and look at previous steps. You may have to adjust those a little bit. The other thing is with concept analysis is there may be multiple analyses of the same concept and come up with different attributes, different concerns, different ways in which those concepts are used. If two of you were doing concept analysis on the same concept, you might find in the literature different ways in which they're used. You might come to conclusion that this concept is best defined this way, and another student might say, well, it's best defined this way. So just know that if a researcher, for example, and using concepts and using theories, they are responsible for defining those for purposes of that study. And so not only do we use it for conversation, but we've also got to study it too. So I'm just going to give you an example of how two concepts might be used interchangeably, but might not actually mean the same thing. If you think of the word adherence versus compliance, are they interchangeable as far as you know?
Yes.
They're interchangeable? Okay. Anybody else?
I said no because I feel like adherence has more uses. Like you can think of like tape or things like that.
Oh, okay. Yep. It does have a lot of different kinds of uses. You're right. If we think about them with patients or with people, sometimes they're used interchangeably. Sometimes they may mean something very different. So, Jennifer, what do you think?
I think with adherence, there's more of an internal, like, I want to do this, whereas with compliance, you're doing it because someone told you to do it. And there's not really a motivation for it.
Okay, okay. So how we use those things are really important, right? So, I mean, it's easy for us to say, well, patients are just not compliant. And so that might mean they're just not paying attention to what I say. The adherence part may be a very different kind of piece of information. It may be that in order to adhere to something, they have to give up something else. In other words, in order to adhere to a diabetic diet, for example, or a hypertensive diet, a DASH diet, they have to give up a lot of sodium. They have to give up a lot of foods that they grew up with, that they know how to cook. And so they have to give something up, so their motivation may be very different in that case. So that's actually what I was getting at in terms of whether or not those things are interchangeable. We use them interchangeably though. And so I think it's important to be clear about what you're talking about with patients and how that comes across to other people. So here are the steps, walk for an AVANT. You all have the textbooks. I'm just going to assume that you all have that textbook. It is, you are using the 5th edition instead of the 6th. The 5th edition was a whole lot less expensive than the brand new one. And what we're going to use out of it really hasn't changed. So just so you'll know, we agreed that we could save you some money that way. But the steps in this book, when you read the chapter of AVANT's work, it's pretty conversational, I should say. And so I'm hoping that will be useful for you. It's 8:51 now. I think it's probably time to take a break. When we come back, we're going to talk more about concept analysis, how you do it, and we're going to do a class exercise with it as well, because you have a concept analysis paper that you're going to be turning in fairly shortly. And so we're going to get started on that. So questions, comments before we take a break? Okay, I will start a timer. We'll go 10 minutes and I'll see you back at 9:02, looks like.
Right now in practice. And it's ideal because you are able to bring, as practitioners, you're able to bring real world experience and application of that concept to life. So if you choose something that's of interest to you, it's much more exciting to be in the concept analysis phase versus choosing something that you have absolute no interest in. Now, I know that we've given you a list of concepts to choose from. Most of those should be relevant to your practice, though. So hopefully they're of interest to you. Helen, I have a PowerPoint. Can I share it?
Yes.
Okay. Hold on just one second. Let me get my PowerPoint. It'll be easier for you to follow me. Can everyone see that?
Yes.
Yes. Okay, great. So we started without you, Dr. Hodges. And we're talking about each step in the process. Right now, we're starting to talk about concept selection and how important it is to choose a concept that you're interested in. But because of class purposes and because we want you to pair with someone, we gave you some concepts to choose from. And I know some of you have signed up as pairs and some of you have signed up individually. You can find that document on Google Docs. So please make sure you go there and sign up to work with someone on a concept analysis piece. So like I was saying, a concept analysis allows a student, such as yourself, to take a concept that you're learning more about in academia and link it to your practice. And hopefully by doing that process, you'll have more clinical relevance to draw upon when you're at the bedside. So there's 3 things that you should think about during the selection of a concept. It should be of interest, like I've talked about. It should have some relevance to your practice. In my case, because I don't have a practice, it should have some relevance to my research interest or some relevance to my education courses that I teach. There should be some lack of clarity, consensus in the literature about what the concept means. Some of the concepts that you'll be looking at, there might not be that much a lack of consensus, but again, this is a practice so that when you are on your own, you can do a concept analysis on something that may be a little bit more oblique in the literature. And the third thing is avoid extremely broad concepts such as communication. There's so many pieces and so many different ways of communication that it would be impossible to nail that down into 8 or 9 steps. In addition to the concept selection, what we're also asking you to do in your paper is to introduce the concept, put some contextual information and understanding to the concept. So you want to talk a little bit about the concept, why you chose it, even though we forced a decision from you. You still should have some interest in the concept. And we want to know how it's relevant to your understanding and knowledge of theory and theory development and current research or current nursing practice. Any questions about concept, selecting the concept? Okay, the second step is to determine the aim and purpose of your analysis. This step helps you to.
I'm sorry to interrupt you. Your PowerPoint is not changing. It's just stuck on 1. I don't know if it's supposed to be that way.
Yes, it's not going to change for a little bit until I go through all of these. Okay. Well, actually it is. No, it's not. Sorry about that. It's not going to change. I'm just going to go through these steps, and then when we start looking at a concept in particular, I'll have more slides. But I really just want you to focus on these steps right now. So the second step is to determine the aim and purpose of doing the analysis. This helps you to focus on what you intend to do when you have this, when you're finished with the concept analysis. Do you plan to use it at the bedside? Do you plan to use it for classroom purposes? Do you plan to publish the results? And there are a lot of people who publish concept analyses. It's very helpful to other people when you can go and look at something that they have done. Step 2 should answer the question, why am I doing this analysis? It's not an end to itself, but it should help you bridge between academia and nursing practice and between theory and research. Walker and Avant stress the fact that it's important to understand why you're conducting an analysis. They go into quite a lot of detail about this. They suggest that you keep the purpose of the analysis front and center so that you don't lose focus. What exactly are you trying to determine from your concept analysis? So I think if you keep something like that in mind, I use sticky notes for that purpose sometimes to keep things front and center in my mind. We're asking that you use the 8-step process that they use in the book, that you identify the 8-step process. So each step should be a heading, such as what I have here in the slide. So you'll talk about each step, and under each step, or with each step, you'll have a heading, and then you'll be describing what you're talking about. Okay. Step 3, identify the uses of the concept. This is probably, for me, the most fun part of a concept analysis because you get to step outside the nursing literature. Begin the analysis or identifying the uses of the concept with dictionaries, thesauruses. You are going to want to use evidence-based articles and theoretical articles, but you're going to want to step outside of nursing and healthcare. Look at things like comic books, pop culture, music, poetry, current literature, and also sometimes historical literature is helpful as well when you're trying to define all the uses of a concept. Do not limit your search to just nursing, because if you do, you're going to get a very biased perspective of what a concept means. Concepts mean different things to different people. For example, nursing as a concept. Nursing as a concept for nurses means something vastly different than nursing as a concept for breastfeeding mothers, correct? So you want to make sure that you include all uses of the concept so that you have a very broad look at the concept itself. Don't limit your concept to just one realm or another. For example, if you're studying something or you're looking at a concept, don't just focus on the physical aspects of the concept and vice versa. Don't just focus on the psychosocial aspects of a concept. You want to look at it broadly. You want to look at implicit and explicit uses of the concept. You may also use slang in addition to those other things that I talked about. Sometimes knowing the slang is very helpful as well. You want to look at literature. It helps support and validate your choice of the defining attributes, which we're going to talk about next, and provides the evidence for the basis of your analysis. So in your paper, what we're asking you to do is look at the broad uses of the concept, broad definitions, how it's used, identify as many uses as you possibly can using your resources, begin with dictionaries and thesauruses and take it from there. Some things, and again, some things that you might not think about normally, such as pop literature, you want to include. You want to also look at other disciplines, and I think that's really important in nursing. Sometimes we're stuck in the nursing realm of reality, and we fail to look at other disciplines and how they may use that concept. You can look at certainly disciplines within the healthcare realm, but you also want to look at other disciplines as well. Now, in your paper, we're asking that you use at least 15 references. Not all your references will be peer-reviewed articles. However, you must include those as well. But you will cite things like the dictionaries and thesauruses that you use. Any questions about step 3? Okay. Step 4, defining attributes of the concepts. Now, this is the heart of the concept analysis. So if you have questions, please ask me. What is an attribute? It's another word for characteristic. So it's defining the characteristic, the defining characteristics or attributes of the concept that you're looking at. In this step, you're wanting to cluster those defining attributes. You're wanting to get to the heart, to the meat of what your concept means. So you may want to start taking notes if you come across things that you see over and over in the literature. Those are some of the things that you want to take notes of. Those are the things that you will tease out and that will become your defining attributes of the concept that you're looking at. So the defining attributes help you when you're developing your concept analysis, but it also helps your audience. If they look at those defining attributes, which you probably will have 3 or 4 of, then you should be able to look at those defining attributes, those characteristics, and say to yourself, oh, they're talking about this particular concept. It should be that crystal clear. There should be no room for ambiguity when you're defining your attributes. Don't be afraid also to be open to changing what you think the attributes might be to what you find when you're going through this process. You know, you may have one thing in mind, one assumption about what it means. However, after you review the literature and look at all the different sources that you have, you may change your mind about the defining attributes. And I think that's important, that you allow yourself to be open to that. Sometimes we get a little rigid in our thinking and we're not able to look outside of our own self. So try to have some flexibility when you're doing this process as well. Sometimes a concept may change over time, or sometimes a concept will change in a different context. So you want to be aware of that as well.
Are there a certain number of attributes we need to have for our concept?
No, great question, but there's not really a defined number of concepts. Usually you want to distill it down to a minimum number. Like you don't want to have 20 defining attributes because then you start getting a little wishy-washy. You want to have 3 or 4 definite attributes that make up the concept that you're talking about. Usually you can distill it down to 3 or 4. And the example I'm going to use in a few minutes, they only have 2. So there's really no right or wrong, but you don't want to have a lot of defining attributes. If we read a paper with a lot of defining attributes, we know that you have not really been able to drill it down to the core attributes, the core characteristics. Does that make sense?
Yes.
In the paper, we're asking that you describe the essential attributes or characteristics, and we want to know how you got to that process. And also, we want to know how we as your audience would recognize that concept when we see it. What characteristics are proposed in the literature definitions? Include as many characteristics as you can until you have a clear sense of the essential indicators that define the concept. So again, you're not going to have tons of defining characteristics. Don't feel like you're not doing well if you have 3 or 4. You may be doing very well if you have 2. We do expect to see more than 1, usually. Any questions about that? I think that's really a pivotal point of your analysis, is getting those defining characteristics or attributes down. Okay, we're going to talk about cases next. Now your paper criteria break the cases down into 2 steps, but in Walker and Avant, it's 1 step. We're looking specifically for a model case and a contrary case. So a model case is what it sounds like. It's a picture of what absolutely is a pure case of the concept. So if you read a case that was a model case of a concept, you would say to yourself, oh, that is exactly what that means. That is exactly the definition of the concept, or it uses all of the attributes of the concept, and I understand truly what that means. Someone said, well, if this isn't an example of the concept, I don't know what is. You want to take the model cases from real life, or you may find them in the literature, or my favorite thing to do, and I think that students really benefit from this, is developing your own model case. And you develop it using pseudonyms, just like you would do anything else. If you're talking about a patient per se, you can use a concept analysis in that way. Some of the best ones that I read from students are where they're based on some actual experiences that they've had, not one particular one, but maybe several, and they use a pseudonym and they go through the case. So you're actually reading a case that makes sense. It's a clinical case usually in most instances in nursing. And when we go over the specific concept that I chose, I'm going to read you a model case, and I think you'll understand it much better than when you have an example. Any questions about model cases? So again, a model case is an exemplar. You read the case and you know exactly what the concept means. It's a true picture of what that concept means. You should get the mental image, as Dr. Hodges was talking about earlier. What do you think a contrary case is?
One that's like the opposite.
Right, it's the extreme opposite of what you are talking about. So can you think of something, that would be the extreme opposite of maybe nursing? If we're talking about the profession of nursing and we know all the attributes of a professional nurse, what would be the extreme or the contrary case for nursing?
Breastfeeding?
Breastfeeding would be one. Also nursing, like nursing calves would be another one that I think of. The contrary case is really important, and sometimes it's easier to come up with the contrast or the contrary case than it is the model case, because the contrary case we know is the exact opposite, and we know what it's not. We know what the case is not, right? So sometimes it's easier to come up with that first. So if you were looking at a contrary case, you would say, oh, this is the exact opposite of the model case, and I understand that because both are laid out really well. Now, the book talks about other cases as well, a borderline case, related cases, invented cases, those kind of things. But for your paper, we're asking that you really specifically look at the model case in the contrary case. And when you're talking about the contrary case, discuss how the attributes are not there. Like discuss the lack of attributes that makes it the contrary case as opposed to the model case. Does that make sense? Any questions about the model or the contrary case? This is probably the most creative part of concept analysis. I enjoy this part because it allows me to do a little creative writing. When I want to look at a model case or a contrary case or other cases, I can use what experience I have, but I also can be creative. And I think that students sometimes don't allow themselves to be a little creative here. And I think it's when you don't allow that, you miss out on some of the points of the cases. Okay, so step 7 is antecedents and consequences. And what I really want to stress here is that you don't make this harder than it needs to be, which is probably my favorite thing to do, is making everything harder than it needs to be. People get stuck in this on this particular step because of the words antecedents and consequences, but it literally means before and after. So antecedents are those events or incidences that must occur or be in place before the concept can occur. And consequences are those events or incidences that occur as a result of the case or the concept. So it's the outcome of the concept. So I think if you can look at it as before and after, that helps you define what we're looking for more clearly. Any questions about that? In your paper, when you're talking about antecedents and consequences, talk about the contextual aspects or the events that must be present for the concept to occur, and the outcomes or events that occur because of the concept. So it's like a before and after. Okay? Step 8, which is the last step in the book, is empirical reference. And I think students get stuck here too because of the vocabulary. But I think as we talk about it and I show you the example, it'll be a little more clear. This is the final step. It's you're nearing completion. But remember, this is an iterative process. So you may be going back and forth, or actually not maybe, you will be going back and forth. But when you get to that last step, you'll want to review everything that you've done thus far. In this step, we're asking, if we are to measure this concept or determine its existence in the real world, how would I do so? So what does that mean to you? Does it mean how we're going to measure it? Yes, how are we going to measure it? How are we going to capture what this means? So they're classes or categories of phenomena that by their existence or presence demonstrates the occurrence of the concept itself. What do you think? We use empirical reference, although we don't talk about it as such, when we're looking at patient education, because what are we doing after we do patient education? We're measuring how someone, we're measuring if someone was able to take the information we provided and do well on a post-test, right? A pre and a post-test. So think of empirical reference as kind of the same thing. We're looking at a way that we can measure the concept itself. Is that clear? If it's not, please ask questions.
Can I add one thing here?
Yes, ma'am.
The antecedents and consequences sometimes end up looking a whole lot like you're defining attributes, and so you have to change that. So I just want this to sink in. A defining attribute can't be either an antecedent or a consequence, right? If an attribute is what makes up the concept, then it can't be what happens before, and it can't be what happens afterwards. So if you're antecedents and consequences start to look like attributes, then go back and look at your attributes, because you want to be sure that they're all separate. So you would have antecedents, you would have attributes, then you'd have consequences. So everybody got that? Attributes cannot be antecedents or consequences. Now, here's one other piece, and that is empirical reference can be attributes. They absolutely can be attributes. So if you can measure what is when that concept exists, then it's an empirical referent. It's something that could be measured when that concept exists. Okay, so just make sure those pieces are pretty clear for you. And in the empirical reference, you may find studies that have already measured your concept. And so you can cite those too, that there may be an instrument or there may be something that's already been developed. But if not, then it could be things that could be developed, that could be measured. Those are usually the things that get students tangled up.
Yeah, thank you for clarifying that and reminding us, because I had it in bold on my notes, but I clearly stepped over it.
Well, when you do this concept analysis as a paper, it's going to be in two parts. So you'll be developing your defining attributes and a model case. You'll get to that point before, and that's in the first part of it. The second part, you do the antecedents and consequences. So sometimes when you're doing the second part of your paper, you've got to go back and revise the first part. And that's perfectly okay. Just know that that might happen. I'm done.
For the paper, we're asking that you describe clear and observable phenomena that can be measured or recognized. And some of them, as Dr. Hodges alluded to, may be the defining attributes of the concept, and that's okay in the empirical reference, but not in the antecedents and consequences. So you may, when you do your literature search for your concept, you may come up with instruments, scales, or surveys that measure the concept that you're looking at. And that's perfectly okay. In fact, that's great if there is such a thing. If there's not, then we know that that needs to be developed. So those are the 8 steps of the concept analysis. Are there any questions before I move on? I tried to integrate all the paper criteria as well. Dr. Hodges alluded to the fact that it's in 2 steps. It is in 2 steps. In the first part of the paper, one of you will take the lead, and then one of you will do the peer review, and then you will flip in the second part of the paper. One thing that I think is really great about the way that this is designed is that you get to talk through the concept analysis with one another, you get to review one another, and you get to flip your role, which I think is a very invaluable learning tool. So I hope that you will enjoy that as well, and that you'll see some benefit from it. So I'm going to move on. I have chosen an article and wanted to look at it through the steps of the concept analysis. And this article is on evidence-based practice readiness. And I chose this article because I thought it was relevant to everyone in the class. But I'm going to go through the steps as the authors have laid it out in their article. And then I will publish this PowerPoint, and it has the references for the article, and you can go back and look at it yourself if you'd like to. So I chose it because I think it's relevant to everyone in the class. The authors chose it because they asked these questions of themselves. How do we ensure that nurses are ready to implement evidence-based practice into their own practice? What does it mean to be ready? Sorry about that, I skipped over one. What does it mean to be ready, and what aspects of practice should be included when assessing readiness? the concept of readiness has not really been clearly defined in the literature, and a definition is necessary to ensure all stakeholders have a clear understanding of its meaning and how to adequately ensure that all aspects of readiness are achieved. So that's why they chose their concept. And it's really important to put and to state very clearly why you choose the concept that you choose. So this is why they chose this concept. And then step 2 is the aim and purpose. So they were very clear, and I put in the notes the page numbers for the article and where you can find this information. And this is straight out of their article. Their aim and purpose was to analyze and define the concept evidence-based practice readiness in nurses. So they're hoping that by doing this concept analysis, that they can answer the questions that led them to develop this concept. Step 3, identify uses and definitions of the concept. So when they started doing their literature search, and they talk about their literature search like we talked about last semester, keeping up with the databases, how many articles, how you refine and define the literature review. They go into great detail about that. But they were able to identify the uses and the definitions of these things that led into, these things are the things that they came up with that really talk about the concept of evidence-based practice readiness. So readiness, nursing, training, equipping, leadership, and development and support are the things that they talked about in their article. And they concluded that these were the pillars of evidence-based practice readiness: nursing, training, equipping, leadership, and all of these lead to improved patient and family care. And as you see, as we go through this concept, you'll see how all of that merges together to improve patient care. The next step, defining attributes of evidence-based practice readiness. There were two attributes that they talked about: the nurse's beliefs of value of evidence-based practice and the level of skill and competency that the nurse possesses. So if you think about evidence-based practice and what we know about it and how long it's been in the literature, you know that some nurses maybe have been educated a long time ago and haven't stayed current, so they don't really value evidence-based practice necessarily. But those of us who really value it, that is one of the attributes of being evidence-based practice readiness. So I would expect that all of you would have this attribute because you've been educated very recently about evidence-based practice. And then the level of skill and competency. How comfortable is the nurse in developing evidence-based practice, and how comfortable is the nurse going to the bedside with what he or she has learned about evidence-based practice? So evidence-based practice, the nurse should be able to look at a patient and know his or her strengths and maybe some opportunities for learning about a particular patient before they're able to go to the bedside with evidence-based practice. So this is how, when they talk about these two attributes, this is how a nurse takes the evidence-based practice and takes it to the bedside. And it's based on the core belief of the value of evidence-based practice and how comfortable he or she feels and how competent they are. So as you can see, I always said like 3 or 4 attributes, but in some cases there are only 2 attributes, and that's perfectly fine. Step 5 is the cases, the model case and the contrary case. I want to read to you the model case as it's defined in their study. And when you listen to it, think about those attributes and see if you can pick out the attributes that they're talking about. Stephanie has been a nurse in the cardiac intensive care unit for 5 years. Later in the day, she's admitting a patient from the cath lab who has been treated with therapeutic hypothermia. It's been a little over a year since she's had a patient with hypothermia, so she recognizes that she needs to get more current, make sure that her practice is evidence-based so that she can care for that patient properly. She realizes that she does not have a time herself to do a literature review. because the patient will be on the unit before she's able to do so. So she calls the hospital librarian, and the librarian does a search for her. The librarian emails her the results within 15 minutes, and Stephanie is able to review those results and know that she is secure in her knowledge and she is relevant, and all of her evidence-based practice is at her fingertips. So she feels confident that she's able to provide the best evidence-based care to her patient who is receiving therapeutic hypothermia. Do you see the attributes? When we talked about that case, do you see the attributes of her belief and value of evidence-based practice and her level of skill and competency? So she really truly understands that evidence-based practice is necessary to provide the best care for her patient and families, and she knows that she needs to have the skill and competency to do so. She knows how to use her resources to get there. Does that make sense to everyone?
Yes.
On the contrary case, the authors did not give a contrary case, but can you think of what a contrary case to the model case might be? Someone take a wild guess. Crystal, can you think of what it might be?
Can you repeat it again?
So what is a contrary case to the model case? If the model case is a nurse who uses evidence-based practice, she believes in evidence-based practice, she knows how to use her resources so that she is able to provide the best evidence-based practice to her patients. What would be the contrary case?
It would be, I guess, a nurse that just does whatever. They wouldn't have recognized the need to look for resources or anything. They would have just, I guess, just tried to just wing it, maybe.
Maybe a nurse that actually goes from practice she's learned earlier that she's used to and just go from the old practice rather than new.
Yeah. Have you heard the phrase, "It's the way we've always done it"? A lot of nurses, unfortunately, still have that mindset of this is the way it's always been done, this is the way we've always done it. And so that's contrary to the evidence-based practice of the model case that we just looked at, right? So a nurse who is current and really values and believes in evidence-based practice knows that he or she needs to do their homework in order to provide the best care possible, versus a nurse who does it the way it's always been done. Now, some of the does it the way it's always been done has been proven to be reliable and is evidence-based, but a nurse who does it the way it's always been done, who doesn't have that knowledge, is contrary to the model case. Does that make sense to everyone? Any questions? Because these two cases are important. They'll be important in your paper. Okay. Moving along to antecedents then. So in this concept analysis, nurses recognize the need for information, they have access to that information, and they practice in an environment that is conducive and supportive of evidence-based practice. So those are the things that need to occur before the nurse can demonstrate readiness to implement evidence-based practice at the bedside. So those are the things that you need to have happen before this occurs. The consequences are improved patient and family outcomes, decreased healthcare cost, increased job satisfaction, which translates into reduced turnover of staff, and also translates into decreased cost of human resources. Empirical reference. So there's a knowledge test that looks at evidence-based practice readiness. It's an inventory. There's the part of it that's the self-assessment part, and there's part of it that is actual knowledge. So they ask that the nurses do the self-assessment piece and then do the actual knowledge test, and they can compare that to see, the nurse can compare it himself or herself to see if what they thought was true was actually true or not. So they actually have a scale that measures the readiness to implement evidence-based practice. And those are my references. Are there any questions? So if you go back to this Schaefer and Welton article in the literature.
Is this slide going to be posted?
Yes, I'm going to post the slides, but also this is the link that you can get to, or you can use the DOI in the library and get this article as well. I'll also post a link for it as well, because I think if you go back and look at that article and take the slides, it will make perfect sense to you. And they've laid it out really well in the article. It's one reason I chose this article as well, but the only thing that they did not have was a contrary case, but I think that's pretty easily developed based on the model case.
I'm still kind of confused about the empirical reference. Can you give like other examples from like a different concept, I guess, on how we can explain that?
So think of empirical reference as being able to measure a concept. How do we measure pain? We measure pain how? Different ways, right? We measure pain. We ask a patient to assess their pain on the pain scale. We look at, what else do? We look at their body language, correct? How else do we know that a patient is in pain?
Look at their vital signs.
So if you're looking at the concept of pain, that is one way that you can measure pain.
So with the empirical reference, are we basically asking, what is a way that we can operationally define this concept? Is that what we're looking at?
Once you operationally define the concept, it's a way of measuring the concept per se. In this case, they were interested in nurses. So they were looking at nurses' knowledge and nurses' knowledge and nurses' perception of their knowledge. Does that make sense? Is that clear? Who asked the question? Becca, was it you?
Yeah.
Does that help?
Kind of. I guess I was reading in the book too to try to figure it out, and they use attachment in the book, and when they give examples, it's almost like how someone's getting attached.
Right. So it depends on the concept that you're using. Some concepts you'll be able to have a survey or a questionnaire or something like that. Some concepts are not that easily, they don't have those easy things that you can take from the literature and measure them, so to speak. Dr. Hodges, do you have any better explanation?
I was just going to say the empirical reference, when you think about empirical, think about things that can be measured, but empirical also things that you can see, hear, feel, taste, touch, that sort of thing. So it could be body language, for example. Empiricism comes from Aristotle. Aristotle was all about the senses. So if you think of empirical reference, it would be anything that you could pick up in your senses that potentially could be measured. If you can see it, if you can hear it, if you can touch it, if you can feel it, and you can taste it. I guess you could use taste. But think of the five senses. So, for example, if you're looking at the concept of hope, it's probably going to have to be things people say, body language, activities they're engaged in. All those things could be empirical reference for the concept of hope. Does that make sense? I know I keep saying that phrase, does that make sense? But if you're trying to look at a concept of, say, let's say learning, learning itself goes on all up here, but there's some things that you can see or hear or tell that somebody is beginning to learn something. So it could be questions they ask, it could be comments they make, it could be body language, it could be their achievement on a test. All those things potentially could be measured. They may not have been yet, but they potentially could be. So just think of things that your senses could pick up that would indicate that that concept existed or has occurred. Does that help? Anybody?
I have another question. So then a consequence isn't always something bad. It's just what happens after the concept. So would the consequence to learning be that they did well on the test?
Uh-huh. Yep. Yep. So learning on the learning demonstrated on a test then couldn't be an attribute, right? It would be a consequence. And yes, you're right. Consequences can be negative or positive depending on what you're looking at.
Yeah. Excuse me. Any other questions?
So in other words, the empirical reference is something that we can perceive and use to say that this concept is there, that it exists.
Yeah, exactly.
I'm just trying to think of a way that you can think about it where you could apply it to any concept and be able to actually understand what it is.
And sometimes that's the hard part, because sometimes we talk about things that we know have happened or exist, and it's hard to put it in words. So if you can think about how you would know something, usually that can function as an empirical reference. If it's something you can see, even if it's body language, or conversations that they use to convey it, or if you can see it, then that could be an empirical reference. Yeah, it would come from your senses. Did that answer your question?
Any other questions? If not, we're going to segue into our group work. Dr. Hodges has divided you guys up.
I have. So I'm going to hang on here. I'm going to go to back here. And okay, I'm going to, oops, I don't want to do that. Hang on just 1 second.
One question. Are we working on the concept that we chose in DocuSign? I mean, or what are we working on?
In Google Docs?
Are you going to give us, yeah. Are you going to give us the examples to work on?
Dr. Black?
That's my plan, is to give you a concept that you can all work on, so you don't have to necessarily, I don't know that Dr. Hodges has paired you necessarily with your partner.
I haven't.
I thought that we could look at the concept of compliance, which we talked about a few minutes ago a little bit.
Okay, so I'm going to hold on, I need to share something here.
Sorry about that.
I'm going to try to share it. We may be stuck. Let's see. Okay.
There you go.
Okay. All right. So sorry about that. So let me get on to the website. It's 9:55. Once you do this, once you take a 5 to 10 minute stretch break, bathroom break, whatever you want it to be, I will get this set up and divide you into rooms. Okay? I'll see you back at 10:05. I'm going to move you into, you'll go into a section on Google, and it'll be easy to just move right in. So hang tight, because I can put you in the groups. All right. So I'm going to show you your groups. So who's in what? All right, so hang on just a minute. I'll share this screen. Okay, so here are your groups. I will put you in a room. I just want you to see who you're going to be in a room with. And each of you will work on a, Dr. Black will give you a concept, but each of you will work on a different step. So group 1 is Eleni, Lana, and Elizabeth. Group 2, Barbara, Charlotte, and Zenobi. Group 3, Shayla, Sonia, and Envy. 4, Crystal, Ashley, and Brandy. 5, Bo, Alexander, Valerie, and Jennifer. And 6, Habita, Vivian, Kelly, and JJ. Is JJ here today? Anybody heard from JJ?
I don't think she's here today.
Yeah, she said she's on vacation.
Oh, I got, okay. Yes,
told you.
You're right. She did. I totally forgot. Okay, so JJ won't be there. Group 7 is Becca, Safira, Sarika, and Demir. And 8 is Jennifer, Bush, Aaron, Marquez, and Holly. So hang on, and your group will be in a room here shortly. Okay. Okay, group 1, group 2, group 3, group, 3, 5, 7, and 8. Okay, now you should be able to okay, that's not working. Hang on just 1 second. Yes, a document. Okay, so Reagan, stop. Let's put group 1 and 2 will work on a document together, and that will be steps 1 and 2 in your Walker and Avan. Dr. Black, do you have a concept for them to work on?
myself. Compliance.
Okay, compliance. Okay. So everybody's going to be working on the same concept, but you're going to be working on different steps of that concept. So group 1 and 2 will work on groups 1 and 2 will work on steps 1 and 2. Group 3 and 4 will work on steps 3 and 4. 5 and 6, groups 5 and 6 will work on 5 and 6 together, and 7 and 8 will work on those last 2 steps together. It should be in a document. And okay, we're going. Okay, so do you have access to the Google Doc? Can you see it? Anybody have access to it? I should move it over here where you can see it. Let's go here. This is not the same one. Hang on. Not the same one. Let's see, Dr. Black, were you talking about things, making things harder than they need to be?
Yes.
Okay. See if this is going to load or not. Okay, I'm authorizing it. There are more steps to it than I wanted to have in it. Okay, we're going to back out of this assignment because it's not working as I had expected it to work. So can any of you, you can see this, I know, you can see it that you shared. Do you have, can you edit any of you edit this? Somebody give it a try, just type a word. Okay.
It won't allow me to.
Okay, this is locked. I'm not going to do that. Okay. All right. Let's not do it this way. Let's not do it that way. Okay. So you have some partners to work with. I gave the name of your partners. I'll put those back up. I think that probably the fastest way to be working on that together will either be with an email or do a quick Zoom. You can do mercer.zoom.usa and quick open a meeting and invite your other 2 people. They're into it.
Does that make sense? So you'll actually leave this screen.
So I need to go back here to, not there. Okay, I'm not doing that. Not doing that. I just love technology.
So are you wanting us to get out of this Zoom and go into a new one with our partners?
Yeah, if you can. I'm trying to give you your partners again. Can you set up a Zoom? A quick Zoom?
I'll try.
Yeah, give it a try. It's mercer.zoom.edu.
I just tried to do it and it says I have to leave this meeting to join a new one.
It says what?
Isn't
That I have to leave this meeting if I want to join. Like, you can't be in both at the same time.
Oh, okay.
Isn't there a way to break off in groups though within this meeting?
Yeah, that's what I was trying to do. Ah, wait a minute. I found it. I found it. I had lost the icon. Okay, hang on just 1 second. It's going to work, ladies and gentlemen. Perfect. Thank you so much. I knew I could find it. Okay, so I'm going to reassign your groups. Don't pay attention to that. And they'll be in alphabetical order. It is coming. Okay, you should have an invitation to join a room.
Before we break off, how long do you want us to be in our groups before we come back?
Do what?
Before we break off in our groups, how long do you want us to be working on this before we join back together?
20 minutes. 20 minutes.
Okay, and I'm missing, if I'm in group 6, sorry, can you remind me which one again we're working on? Because I was in group 7.
Okay, so, oops. Group 1 will work on step 1. Do you have your Walker and Avent there? Anybody? Do you want me to put up the PowerPoint?
Yeah, if you can.
I'll put it up.
I have my book online. I'll have to look at it.
Okay, let me put it up and I'll remind you the steps. Oh, there you go. Okay, so group 1 does not get to do step 1. Group 1 gets to start with step 2. Okay, so group 1 will do step 2, group 2 will do step 3, group 4 will do step 5. Group 5 will do step 6. Group 6 will do step 7. Group 7 and 8 will do empirical reference. Everybody got it?
Got it. Thank you.
Okay.
Dr. Hodges, I'm in group
Yes.
8. Do you know the step that we're working on?
Which one? You're in 8? Which group are you in?
Yes, ma'am.
8. You're going to work on
Group
step
8.
8. And you're going to work on step 8.
Step 8. Okay.
Yes, ma'am.
All right. Thank you.
Mm-hmm.
So do you use the invite? Is that what you do?
Well, first of all, set them up in groups. Canvas will randomly assign them to groups, but then I couldn't assign the groups to the breakout rooms. So when I set up the breakout room, I couldn't find that icon. I knew there was a way to get them into groups. So I was furiously trying to find collaborations. Well, that didn't work. So it's the icon for breakout groups I needed. Anyway, so then I had to assign directly into the rooms from the list. That's why they ended up being alphabetical order. I didn't randomly assign them because it was I didn't have enough time to do that. I randomly assigned them in groups in one place on Canvas, but when I got ready to assign them in groups, I couldn't assign the Canvas groups to the Zoom rooms. That was the problem.
So how did you wind up doing it?
How
did you assign them to the rooms?
When you get ready to assign them, it'll give you a list of students who are in the class. And I just clicked on, like, 1, 2, 3, this will go to Zoom, room 1, 1, 2, 3, this will go to Zoom 2. I'll show you when we
That's
can.
what okay.
I'll show you when we can sit down together.
Okay. Okay.
Holly, are you having trouble? Are you supposed to be in a room?
Yeah. Our group's confused on what we're supposed to be doing since we got put into different groups.
Okay.
And we don't know what numbers we're supposed to be doing.
Which room?
So we don't know what our assignment is.
Okay, which room are you in?
So I broke out to try to find y'all, and I found you.
Okay, so you're in room 4. So you're going to do the model case of compliance.
The model case of compliance.
Uh-huh.
Okay. Do you know how to put me back in my group? Okay.
I'm working on it. Trying to get you back in your group. It doesn't give me that option to put you back in your group. Hang on tight. Let me see if I can go back and do a minute. They're going to think you have abandoned them. Okay.
Well, I told them that if I didn't come back to come look for me because nobody else wanted to break out of the group.
Oh, I like that. I'll go in there and be sure everybody has their, I don't know why they won't let me put you back in that group. Okay, I'm going to put you into another group and then see if it'll let me switch you back. Okay? So hang tight. You'll probably get an invitation somewhere else. So I'm going to move you to breakout room 1 and then move you back to 4. We'll see if that'll work, okay?
Okay. Okay.
Did you get an invitation to move to 4?
Oh, wait, I have a little thing. No. Oh, wait. Yes, no, I did. It says to move to breakout room 1.
Okay, so move there, and then I'm going to move you back to 4.
Okay.
Okay, there's Holly. I'm going to move you back to 4. And you should get another little invitation. Did you get an invitation to join?
She's gone from here.
Yes, she's in there. She's in group 4.
Yeah, you'll have to show me when I can see it.
Yeah, I will.
Complicated.
Yeah.
So they're not gonna. Do you think they're gonna all have time to share by the time we get back together?
I don't know that they will, but at least we'll know if they have questions about what they're doing.
Okay.
Maybe that'll help.
Okay.
I'm sending them all a message. What can I do for you?
We just, your little chat thing popped up at the top.
Uh-huh.
But we couldn't read all of it, so we didn't know what you were trying to tell us.
I just wanted to be sure that you all got which step you're doing.
We're doing attributes.
Okay.
Right?
Got it. Just want to be sure. Yep.
I think that's what we're supposed to do.
Everybody okay?
Yep.
Okay.
I think so.
All right. So you can use the internet. You can use whatever you want to see.
Thank you.
And see how many, see how many attributes you can find. Try to narrow it down as much as you can. Okay, so I'm going to hit another breakout room.
Oh, there she is.
Here I am. What can I do to help you? Hello?
I have a question for you.
Yes, ma'am.
So, like, when we're defining a concept, do you want us to define, like, there's all the steps, you have the first step, the aim and purpose. Do you want them to be defined, like, we were working on compliance. So do you want compliance to be defined as compliance itself, not related to the nursing in the beginning, and then would you on case studies, or they identify the use of concept, or do you want to use the compliance that already related to nursing?
Okay, so which one are you doing? You're doing the aims and purposes? Is it the aim and purpose? Is that what?
Yes.
Okay. So you just want to be able to explain what is the purpose of doing the concept analysis. Just be able to put that in your own words. What's the purpose? And then if when you're doing your paper, you would say, well, the aim of it is to use Walker and Avon's 8 steps. And you would list those 8 steps.
So it would be something very generic.
Yeah, it'll be very, So because remember the purpose is, why do you want to do it? So it could be to better understand the language, for how you talk about patient care and the extent to which they are actually involved with their own goal setting and things like that. And then the aim of the paper is that you use Walker and Avon's analysis steps to further explain and clarify the concept of compliance.
I don't know if I understood exactly what it will mean. Like, I got a little confused. Sorry. I don't know if you guys got it.
Okay, so your purpose in doing your paper, which will eventually paper. Right now it's compliance. Okay, but the purpose is to what? To better understand exactly what compliance means so that you use the term correctly. That could be your purpose. And the aim of the paper.
So then you're talking about a purpose on a generalized meaning.
Yeah.
But like, for example, compliance on this, we're just talking, the purpose would be to understand what compliance itself means.
Yes. To further clarify.
You're not addressing to nursing, to physics, to anything.
No, your purpose would be to look at compliance with respect to nursing and nursing education and patient care, and exactly what compliance means.
You're already going to nursing then.
Yeah, at that point, because you're setting up the whole purpose of this paper is to look at the meaning of compliance within the discipline of nursing. And then you would say the aim is to do a concept analysis based on Walker and Avon's 8 steps. But when you look, you won't go to the second step right now, but when you do in your paper and you're going to look at uses of the concept, that's when you branch out and say, well, it's used in this way, in this discipline, this way, in this discipline. But actually, we're going to look at it only for nursing.
Okay.
Does that help?
So that you would do that on, I took a picture of your slide, sorry. On, like the 3rd step, identify use of a concept, that's when you use.
That's when you branch out, yeah. But early on with the purpose, and you just want to be laser clear on what the purpose of your paper is. And the purpose of the paper is
just kind of like a thesis statement. Okay.
Yeah. Okay?
Okay.
Got it.
Thank you.
You're welcome.
Oh no, I can't hear you. You're muted.
Okay, I'm back. And Kelly, are you there?
I'm in 2 groups. I'm in my breakout group on my computer, but I joined on my phone just to make sure I didn't miss anything.
Just pick one. You're fine. Just pick one.
Okay.
someone came on and asked what they were supposed to be doing, and I told them that they could do what they thought they were supposed to be doing.
Let's see. Kelly is she's in 2 rooms. Kelly's in room.
I'm in group 5.
Oh, you're in 5? Okay.
We had came back in, Jennifer did, just to make sure that we were doing the right thing. Group 5 did the model case.
Yes. Okay.
Okay. Thank you.
Perfect.
There we go. I'll have to get much better at this before we do this again.
Well, so will I. Definitely.
The first way.
It works easily. And I was used to doing it in Moodle, but I hadn't done it in Canvas or Zoom. But it's really not hard. It's very easy.
Did you have a good weekend?
It's been busy. Yes. My friend left this morning about 7:45. Hi, Sonia. What's up?
Hi, Sonia. Mute yourself.
Okay.
What's up?
You have a question? You're muted. Sonia, you're muted.
Oh, so it says come back 10:43, so I just came back. I was already done with my partner.
Oh, you're already done.
Can you hear me?
Yes.
I can hear you.
Okay.
So you're already done. Which one did you all do?
The concept was, so we did the last one, empirical reference, and we talked about hope. I think was that the concept she asked us to talk about?
Compliance.
Yeah. Oh.
You might want to go back and think about that a little bit.
Okay. All right, then. We'll go back.
Okay.
Compliance. All right.
Can you get back by yourself? Okay, good. We're all going to have to get better. Hi, Jennifer.
Hi. I was just checking to see if we were back yet.
We're not. I can send you a message when we're ready.
Oh, okay, perfect. I will go back to the room.
I'll do it. Okay.
Lessons learned.
I could make this a little smoother. I'll give them a. I can close all the rooms. If I close all the rooms, what will happen?
They'll all come back here.
Oh, will they? Okay.
Well, I don't know. I mean, that's a guess.
Ew.
Either you'll kick them off entirely, or they'll all come back here. I really don't know what.
Well, it looks like they're able to come back on their own. So I'm going to say, okay, 2-minute warning. I'll just send a message. Nope, stay right there. No, not right now. Not right now. Hey, Sonia.
I'm trying to go back to my breakout room, but it's not showing. I cannot. I don't know why.
Not letting you go back. Let me see if I can help.
Right. It doesn't say anything right now. Right.
I don't see you anywhere. Oh, there you are. Okay.
Yeah.
Which room were you in?
7.
7. I'm doing it.
All right. All right. I got it.
Hi, Hoda. All done?
Yes, I'm the first one.
You're the
Okay,
first
all
one
right.
back. Oh, there's Erin.
Okay.
Demir's back. Brandy's coming. So we're probably all going to have to work a little harder on moving in and out of rooms. Sorry for the delay.
Okay.
Oh, everybody's coming back. Now, I could have closed all the rooms, but I was afraid I was going to send you into outer space if I'd done that. So I'll just try that another time. I'll see what happens. Okay, looks like everybody's back. All right. Now then, so the whole point of this was to at least work through 1 or 2 steps of this concept analysis. So tell me first of all, tell us first of all, what your step was and what you decided, and whether or not you were able to finish up.
So it was my understanding that we were doing the model case in terms of compliance. So I just thought, just any kind of model case that could demonstrate compliance.
Yeah.
And I just took it from the perspective of like, if we're trying to get a patient like on the DASH diet, we would talk to them about food choices, emphasize gradual changes, incorporating exercise, and then have progress updates at follow-up appointments and assess them for their self-efficacy and also their results. Is their blood pressure going down? Is their weight going down? And their self-report, that would be evidence of their compliance to that particular regimen.
Okay.
And that would be a model case for that working out.
Okay.
I don't know if about that the right way, but that's how I saw it.
Well, I can answer, or Dr. Black can answer either way.
When you're developing a model case, just remember to make it like a clinical scenario. So you use a pseudonym and talk about the model case from that perspective and what that model case would look like in practice. So a model case of someone adhering to or being compliant with the DASH diet, how that would look. So he or she would do what exactly to follow that DASH diet. Does that make sense?
Okay, so you would just have kind of more specifics particular to that DASH diet.
Yes.
Okay.
In fact, I would start out with something like, Jason Smith, who has consistent hypertension, has been asked to go on to the DASH diet, and he comes into the office, and so then you describe the scenario. So when he's asked about foods that he's eaten, he responds in such a way, and the practitioner asks him another couple of questions, then they decide that he has met all of his goals. He is demonstrating So you're really just saying, he said, she said, he said, she said, kind of a snapshot. And that would be your model case. So when you described it, Demir, it was more like what the practitioner would do when you really want a snapshot of, just think of a little cameo that you would see in a video. So-and-so walks in, he says this, physician says that, or the nurse practitioner says that. And so you just describe it as somebody would actually see it.
So you want to set the scene, basically.
Yeah, set the scene. Yeah, that would do it. Yeah.
But this can be something that, that I'm putting on paper from my head, or do I need to find this? Okay.
I mean, it could be from your practice. It could be something that you make up. It can be from a movie scene. It could be, it could be any of those kinds of things. But what you would do is you would write a paragraph or so about the vignette, and then another paragraph that explains the attributes, which you will have written once you've done your paper, how those attributes are demonstrated in the model case. In this case, you didn't have the attributes, right? Because somebody else was doing them.
Mm-hmm.
And so you sort of incorporate that in your discussion. But eventually, when you write your own concept analysis, you'll have your 3 or 4 attributes. You'll develop a case based on that. And then you'll explain to the reader each of those attributes and how they were conveyed in the vignette. I'm looking this direction because that's where your face is on my computer. Okay, does that help for the model case? Okay, okay. Who else? Erin, what were you all doing?
I was in Demir's group doing the model.
Okay, good. So was that clearer for you for the model case? Okay. Abida, how about you?
I was also in the same group.
Okay, good. All right, everybody's all aligned. Holly, how about you?
I was in Demir's group too.
Everybody was in Demir's group. Okay, how about you, Ashley?
I was not in Demir's group. We weren't sure like exactly which one we were supposed to focus on once we got put in different groups. So we kind of went through everything as best as we could. So we started out with the aim and purpose, and we said it was to broaden our understanding of compliance in order to improve our practice at the bedside and improve patients' adherence and to clarify concepts that build upon best practice. And then we looked up the definition of compliance in the dictionary, and it was conformity in fulfilling official requirements, disposition to yield to others, and then there was also kind of an outlier, the ability of an object to yield elastically when a force is applied.
Mm-hmm.
So I don't think we would use that one for our the reason we're doing this, but then we came up with 4 different attributes of compliance.
Mm-hmm.
And we said conformity, obedience, adaptation, and cooperation.
Okay. Okay.
And then we had the same model case that Demir did.
Okay. All right. All right. Good. Thank you. How about you, Barbara? Were you in Demir's group?
No, I wasn't a part of that club, but I was in Ashley's group, and she actually did a very good job. So she spoke on everything that we did. I have nothing to add.
Okay. Okay. And Vivian, were you in Ashley's group?
No, I was not.
You were in Demir's group.
No, I wasn't. I was in Zenebe's and Valerie's group.
Okay.
And we talked about the empirical reference Basically, we used a clinical illustration about maybe a client with diabetes and how we're going to know that education on either diet or insulin, whatever it's being used, if the patient was compliant in the 3 months by using, because in the empirical referendum, you have to have an instrument test to define if the theory was compliant, like the compliance that we're using. So we said we are going to use the A1C, the hemoglobin A1C, to see if the patient was actually compliant with the education and treatment method that was prescribed for the patient. And also, we also talked about the CLAPSI in hospital, how we can find out if the hospital has been compliant. It's to see the study or the survey we do in a year or in 6 months to see if the hospital had any incident of CLAPSI, and we can investigate that unit, what happened, plans was followed. Yeah.
Yeah, good. Y'all are right on target. Cinnaby, you got additional add-ons to that, or you're good?
Well summed, so I won't add into that. That's all I said. Thank you.
Okay. How about you, Valerie?
No, can't follow that. Vivian did a great job.
How about you, Crystal?
I wasn't in any of their groups. It was me, Becca, Brandy, and Charlotte, and we did the defining attributes. So we just kind of really quickly all Googled definitions of compliance because it was kind of hard to know attributes without having the definitions. So then, like one of the general themes, I guess, that I wrote down was responding in an expected manner.
Okay.
And then because a lot of the ones, it was like acting in a way that is expected, or that kind of thing. And then I think Becca wrote down a different one. Maybe.
Okay. Becca?
I did not write anything down, but
sorry.
We talked about how it's okay. We talked about how it's kind of hard to talk about the attributes without looking up the definitions first and knowing all the different definitions that we would use. But basically, most of them have to do with either conforming with or agreeing to wishes of others, or responding in an expected manner, like lung compliance. It's not always just patient compliance.
Okay.
Or like when law, conformity to the law. I mean, compliance for the law.
Okay. Okay, good. So you all have found some different uses for compliance, right? It's used in different ways. And so one of the steps is to look at how it's used in different ways. And then you tell the reader, for purposes of this paper, we're looking at how it's used in healthcare or nursing or that sort of thing. So yes, and compliance certainly has a physics piece to it as well. All right, so it is 10:58. I'm not going to get to everybody, but it does sound like once we got everybody in groups, we're all going to have to work at being better, and mostly all here, at getting you in groups quickly, but you got your work done. You did exactly what we asked you to do. So anybody have questions or comments about the step that they were doing that they didn't understand?
I just wanted to clarify, so our reference list is due next Tuesday, correct?
Yes, yes.
Okay.
Okay, there's a group contract due today. What is that?
It should be on, it's just, you are, what you agree to with your partner, like you did in the summer with your concept paper. So it's you and your partner with your concept paper, concept analysis.
Okay, because I couldn't find a template for it. Is it the template on modules again?
Yeah, look up under course resources in that module and see if it's not listed there. And I'll check it too, to be sure that it's there and you have access to it.
I think it's under assignments. I think I remember seeing it under assignments.
Under assignment?
I have a
Yeah, it's
question
under
for you.
assignment.
Okay.
Yeah, I see it there.
Okay.
Dr. Hodges, I don't have a partner for on the Google Doc.
Okay.
Can I another group?
Oh yeah, yeah. You can choose anybody you want to for the Google Doc. This was just an in-class.
So is that okay for your trio? No, like, cause I'm the only one that's there without a partner. Is that okay if I join a group that's already with 2 people?
The only odd number.
Yeah.
Oh, you're the odd man out? Yes, you can join another
I
group.
don't have a partner either.
Oh, Safira doesn't? Okay.
Okay.
Can you work with Safira?
Yeah.
Okay. Everybody else got partners?
I have a question.
Yes, ma'am.
So we have a group contract due today.
Tonight?
I don't see the Dropbox for that in my assignments.
I only see a group contract for the presentation.
The one that's July 10th.
Okay, okay. I'll get it. I'll straighten it out as soon as we leave class.
Okay.
Okay? All good? Okay. You're going to be late. All right. Take off. I'll see you next week. Good job, everybody.
Thank you.
Thank you.
Oh, hi, baby.
Thank you, Helen.
Pause. I see your pause. I see your pause. Just oh, ouch. It's a big paw on my face.
Hi, Megan.
Did you see Vicky?
Hi, Megan.
She's talking to you. She's talking.
Megan only has eyes for you. She says, "Take me out, Mom."
Take me out, take me out. Can I just come back in a second?
Yeah, sure.
Do you have a second to talk?
Yeah, sure.
Okay. You still got company?
I'll not wait. Left this morning.
Join the crowd. Okay, be right back.
All right. Oh.
Okay, I made it back.
Oh, that was fast.
Yeah, I guess she thought it was hot out here.
Oh, is it muggy? I hadn't been out yet.
Oh, wait a minute. She's waiting for some water. You want some water? Okay, all good. I think I like that activity. That was smart. That was smart for you to do that.
I knew it'd be kind of hard on the attributes and stuff, but I think it's worth going through the exercise just so you know what to ask.
Yeah, I agree.
I think concept analysis is hard for students in the beginning.
Yeah, I think so too. And it seemed like when they broke it down, it didn't seem quite so hard.
Yeah, I hope that was my thought was that they